Mrs. Smith. My name is Maria. I'm going to be doing your breast exam and I'm going to be inspecting your genitalia. So at this point, I've already introduced myself to my patient. I've checked the chart, made sure that it's the correct patient. I've already washed my hands. I've donned my glove. And I'm going to start with the breast exam first. So, okay, Ms. Smith, I'm going to pull your gown down just a little bit. Don't worry, I have the curtain pulled for privacy. And I'm going to check for any abnormal findings, such as edema, masses, the size of each breast, making sure that they're somewhat symmetrical. And I'm also going to be assessing the nipples for any discharge or any kind of ulcerations. So, Ms. Smith, the next thing that I'm going to ask you to do is to raise your hands above your head, please. And so with that, I can still assess the breasts on the side, below, just seeing that everything looks pretty normal. And I'm gonna verbalize to my patient to bring their hands down and press on their hips and ask them to lean forward. So I can ask my patient to sit up and do that for me. And this way I can observe the breasts, how they hang unnaturally. And I'm also gonna ask my patient to flex their head. So that what that means is having them put their chin towards their chest as they're sitting up. And at this point, I can begin to palpate. So my patient is sitting up at this point, flexing their chest, flexing their head towards their chest. And I'm going to palpate the supraclavicular nodes, which is above the clavicle. Then I'm going to keep doing that as I'm laterally moving to the sternocleidomastoid muscle, palpating in circular motions. And now I'm gonna ask my patient to have put their hands to their side, and I'm gonna palpate the breasts in a downward circular motion, making sure that I'm not feeling any lumps or anything abnormal. Okay, so at this point I'm done with my breast exam. I'm gonna cover up my patient. Okay, Ms. Smith, I'm moving down to your genitalia. So I'm gonna raise the gown up. Don't worry, I have the curtain pulled. I want to make sure that my patient feels comfortable and has the privacy. So what I'm going to do first is assess the characteristics of the pubic hair. I'm going to inspect the color, the edema, any lesions on both sides of the labia. I'm going to inspect the clitoris first, the urethral orifice, and then the vaginal orifice. And after that, if I don't notice anything abnormal, then I can chart whatever my findings are. Okay, thank you so much.